Let's talk a little bit about lab testing. One of the questions I've been getting a lot lately is asking whether or not we can retest for Lyme disease and to see whether or not the levels have, quote, gone down. Now this is kind of a misconception that what lab testing does. Lab testing is not, in the case of Lyme disease, we don't have a lab test that can tell us how bad the infection is. So it's something that, and I totally understand the reason why people want to know that. I mean, it seems kind of make common sense, right? If they tested positive for an infection at one point and they're starting to feel better and they want to know, is the infection gone? You would think you could retest to find that that infection is indeed gone. However, in the Lyme world, we have just a couple of tests that we can use that actually give us some real data. Any infectious disease testing, there's two main methods of testing. There's what we call a direct method of testing, and then there's an indirect method. The direct method is how we basically locate that virus or bacteria, and if we can see it, whether that be with a culture where we can grow the bacteria, or whether that be with what we call a PCR test, which then looks for the genetic material of that particular virus or bacteria. Those two tests are directly related and correlated with an infection. So if we see a positive on one of those things, we know that that bacteria or virus is there. The problem with Lyme is, how do we isolate and get that bacteria so that we can either grow it in a culture or so that we can actually look at the genetic makeup of it in a PCR test? And that's the problem about this whole idea of testing and retesting. The thing is that we really have a very difficult time with that. Culturing the Borrelia bacteria, it's a very long process and a very difficult process. And even if you could isolate that bacteria, it may or may not grow. It most likely will not, actually. So that's the challenge there. Culture is just not a very sensitive test when it comes to Lyme. A PCR test is the same, but in a little different way. The problem is that we have a very hard time isolating the bacteria directly. So to actually see the genetic material of that bacteria, you have to find it, and it's just not there typically when we do a blood draw. The shape of the Borrelia bacteria is a spiral shape. It's a corkscrew, and it has a motion that actually allows it to kind of burrow into tissues, and that's how it gets around your body. So we're going to find that bacteria in other areas, muscles, joints, nerves, and we're not going to find it just hanging out in the bloodstream. So when we're testing, a direct testing method for Lyme disease just isn't all that helpful. So then we're left with what's called our indirect methods. Those methods typically are what we call a marker of something. Like, for instance, there's markers for tumors, there's markers for inflammation. A marker for an infection basically is an antibody. If your body produces antibodies towards a particular bacteria or a virus, then that gives us evidence that bacteria or virus is in your body. So it's like the smoke to the fire. If you see the smoke, you know there's a fire somewhere. So herein lies another problem. So number one, if there are antibodies present and you treat Lyme disease and you get better, there still could be antibodies present for years to come. So looking at the antibody level is not going to do any bit of good as far as telling us whether or not Lyme is still there or not. The other problem we have is that the bacteria that causes Lyme has a way of evading your body's immune system. There's a really good animation. I posted this actually on our Facebook page a couple days ago, and I'll put a link in the description down below. It's from the John Hopkins Lyme Disease Research Center. And they've got a good animation that explains and shows why it is that our body's immune systems don't always detect it. So if your body has a difficult time detecting Lyme, it's going to have a difficult time producing antibodies. So that is another confounding variable here, another factor that makes it difficult for us to rely on an antibody test. Number one, to confirm Lyme, even in those cases. That's why some of these testing methods are so difficult, and sometimes it's so hard to find it. But it also gives us a reason as to, why retesting really doesn't do all that good, because if the outer surface of the bacteria is changing and your body is not recognizing it like it used to, your body may simply stop producing antibodies because it's not seeing it as a threat. It's not seeing what it initially saw. So the lack of antibodies cannot tell us that you are healed from Lyme disease. So what do we use? The best telltale signs that someone has conquered Lyme really has to do with the clinical picture. So number one, if we've had adequate, and by adequate I mean the correct medications, herbals, or other treatments that kill Lyme disease, and the correct length of time, which it varies per person, so there's not a definite rule of thumb. It's more well understood in more acute cases when someone has just been bit by a deer tick and contracted Lyme disease. We know that a certain length of time tends to be more easy to predict. But for someone who has had persistent Lyme, for someone who has chronic disease or chronic infection, that length of time is going to vary. So number one and number two, adequate length of time, correct medication or groups of medications for the different bacteria or co-infections that might be there. And then really, how are we responding clinically? So every time I see a patient, I always ask them for changes in their symptoms. And a lot of times I have to go back to some of the initial intake forms to look at what did they say to begin with? What were they feeling when they first got here? The journey can be kind of long for some patients, so it really helps to look back and say, here's what you said. Here's what was going on when you first came into the clinic. Where are you at now? And a lot of times we see progression because it's kind of subtle. We don't see it from visit to visit as much as we see it from year to year or month to month. So I think that really you have to judge it based on your clinical perspective. And if testing itself is still helpful, it's still important. It's something that we still use to try to find and confirm a diagnosis of Lyme disease, but it has its limitations and it can't be used to tell someone if they are cured or not.